So I'm sure that we have all encountered many challenges with data collection, even before we had this major, terrible pandemic. However, the pandemic will certainly cause us to rethink how we go about data collection when confronted with a pandemic of this magnitude and nature, and how we will collect data in what is now considered our new normal environment. The presentation will be made to all participants after the webinar, so just bear that in mind. So I'm just going to give a little background before I get into the actual presentation. So the impact of the COVID-19 pandemic will certainly transform and change the manner in which data is collected. It may also seriously impact the amount of data that can actually be collected. As evaluators, we all know that data is the lifeblood of evidence-based decision-making, and that data collection during a major crisis is more important than ever. In this new environment, the work of evaluators may also be accorded lower priority because of financial crises that the global economy now faces. As evaluators, we therefore have to strategize on how we can reframe evaluation so that policymakers can see evaluation as a critical and essential activity that can provide real-time and evidence-based data to help policy making. As previously alluded to, trying to collect data during the COVID-19 crisis would have presented somewhat of a nightmare for anyone, evaluator or researcher, who was in the process of data collection during the time period of the global shutdown. Even data that was urgently needed during that shutdown would have been difficult to collect. For instance, at the individual country level, governments would have required data on vulnerable groups, the identification of the most vulnerable, the extent of the vulnerability, the sources of vulnerability, the ability of affected persons to cope with the pandemic, and so on. Since we had no other choice, we naturally gravitated towards technology as our go-to means for collecting data during the pandemic. However, while technology is indeed wonderful, we would have all experienced some challenges with this method of data collection. We are now going to examine some of the challenges that were experienced during COVID-19 with data collection, which are also likely to continue into the future. I will first begin by presenting some of the challenges already documented, and then zoom into some of the challenges and highlight some additional challenges which I've thought about. Of course, with time, we can overcome most challenges, but they are very real when they initially emerge, since instant training and retooling is not possible in the immediate short term. So many of you would have probably attended the US IDEAS webinar on April 1st, where this information on slide 2 and 3 was gathered from. So of the 200 plus participants that were polled, the major challenge facing most participants was access for on-site collection and monitoring. We see just about a quarter of the participants, less than a quarter, actually having challenges with shifting to a remote platform for data collection, adjusting to working with staff remotely, etc. So we are very versed in doing this already, because we have been privileged in the Caribbean and elsewhere to have good technology for the most part for a pretty long period of time, and we have been using that technology to our advantage. On slide 3, when they poll to look at how were organizations adapting M&E as a result of COVID-19, we see that most participants were using remote data collection and monitoring. So while very few were actually affected by this, most people were able to quickly switch to it. Nonetheless, we do have challenges when we do it, and we're going to look at some of those challenges. I'm not going to go through all of the points on the slide, because you will get the presentation, so you can read them at your own leisure if you've not already seen them. This data was actually taken from the Canadian Association of International Development Professionals, and this was done on April 6th, and they listed some of their concerns with evaluations during the pandemic. For example, how the pandemic will affect their data collection, the practical conduct of evaluation during the pandemic, issues like key stakeholder priorities having shifted, etc. So again, you can read through these at your own leisure, and I'm just going to go into some of the challenges at this point. The use of technology. So during a crisis such as COVID-19 or any other major crisis that requires curfew restrictions, technology can now become our go-to platform to collect data. We are all comfortable with it according to those polls from those two international organizations. However, although the technological revolution has impacted our lives in many very positive ways, the reality is that in many parts of the world, many groups are still without access to basic infrastructure, such as electricity and internet. And even when this infrastructure is in place, certain groups may still not have access because of poverty. And I'm sure that we've all witnessed this in our respective countries, especially maybe not particularly pertaining to data collection, but we could have certainly seen it in our education system where primary and secondary school children, a number of them were not able to actually access any educational platform from the Ministry of Education because they didn't have a tablet or a phone. And if they did, some of them did not have internet and perhaps even electricity. It was certainly a problem in Barbados. So from that perspective alone, we know that this is a true statement that in many less developed countries, people may not actually have access to internet and electricity. Even if the facilities can be afforded, certain shocks such as natural disasters may make certain types of infrastructure, such as electricity, telephone, and internet, not functional. Therefore, the use of certain types of technology, such as Skype teleconferencing and WhatsApp, which are free communication platforms, cannot be used to collect data. Additionally, getting contact information for persons that fall into the most vulnerable groups during a crisis is a difficult endeavor at best, especially when government offices are closed and there is no access to secondary data sources maintained by government. Now, to deal with the problems discussed on slide 5, we could actually use prepaid phones and deliver them to our participants who don't have access to electricity and internet. However, again, during a major crisis like this very unusual pandemic, which none of us had ever before witnessed in our lives, because of the mandatory curfew restrictions and lockdowns, we would not have been able to be physically out even delivering these phones. So the governments would have probably needed to partner with their police who were frontline workers to get these phones to these participants once we could have determined who these participants were. However, we know that if we have to resort to this, we will probably have to buy additional phone batteries, phone credit, and delivery of the phones to the right participants. Moreover, unless the phone is linked only to the interviewer's phone number, the credit may be utilized for purposes other than the interview, and interviews would also need to be conducted in a relatively short time frame or the phone batteries would become depleted. Now, internet connectivity issues can be quite problematic. Under the best of circumstances, we have internet bandwidth fluctuations. I have been using my computer over the last 4 months in particularly, maybe about 10 hours a day, 7 days a week. And I pay for a relatively good internet package. And yet every 5 minutes, I see a little note popping up at the bottom of my screen, internet connectivity lost, internet connectivity restored. So we know that during a curfew, internet traffic would definitely pick up, which means that bandwidth would decrease. Losing communication constantly can frustrate the interview process, and both the interviewer and interviewee can become quite frustrated, not only with the internet connectivity issues, but also with other distractions in the home environment. Now, the suitability of electronic surveys could also be a concern. So even if the technology is in place and people have access to technology and the devices to use the technology, the use of electronic surveys may still not be highly suited to every type of population because of reading and writing deficiencies. We could still overcome this problem by perhaps using an interviewer to administer the survey and then recording all of the responses. However, we know that if we were to use this as our go-to resort, that it would have considerable cost implications because basically the person would be functioning as an interviewer and would take quite a lot of time to read the questions and then record all of the responses. Working from home. I'm sure we'll all have a lot of stories to discuss in our 15 to 20 minutes at the end of the session. But working from home definitely presents many challenges. Conducting interviews from a home environment is not ideal and can be quite problematic for both the interviewee and the interviewer. Both require some quiet time and space, which may not always be possible with the entire family at home. Only this morning when Valerie and I were trying to connect earlier, Valerie was actually doing babysitting duties and was getting distracted. And I corresponded with a publisher recently that an automatic email was generated as soon as I sent a request, and it says, I have 2 young infants at home, so please bear with us and know that it's going to take much longer than regular to get back to you. So we know that we have a lot of distractions and different things occurring in the home environment. Some persons do not even evaluators themselves, much less the interviewees, would not have a quiet space dedicated for an office or a study, and they're just working out of their kitchens, or as we look at news, we see lots of people actually have their computers on their kitchen table or in their dining room, and that's where they're working from. But then we have all these other family members around, buzzing around, which can really create some problems when we are trying to collect data. So persons who are distracted with personal worries and chores may not be very focused. From an interviewer's perspective, trying to answer questions when distractions are ever prevalent is very difficult. If family members have also lost their jobs as a result of the crisis, the interviewee may not be in a frame of mind to answer questions due to worries about how bills will be paid and food will be purchased. The International Labour Office website on April 29 suggests that nearly half of our global workforce is at the risk of losing livelihoods. Whether you lost your job outright and was made redundant, or you got reduced working hours, about half of our world's population, they are suggesting, will lose their livelihood in some way or another. So those are very concerning statistics. The UN News also reported that we have 264 million people that suffer with mental health problems such as depression and anxiety. Imagine the millions more that would have been added to these numbers by this crisis, because this crisis has really affected people's equilibrium and their future and what is going to happen to their future. And some people are not at all accustomed to being in isolation for such a long time. And by virtue of the fact that they were locked down for such a long period of time, it could have seriously affected a lot of persons' mental health and well-being in terms of anxiety issues from job losses and where was money going to be coming from to pay my mortgage and buy my food, etc., as well as depression from being in this close confinement. So these are very serious issues that we need to take into account when we are interviewing participants or surveying them and we're not getting the kinds of responses that we would like or hope to get. Another concern is that adherence to important protocols that need to be observed for certain types of sensitive interviews will also be an issue when the interviews take place in the home. For instance, interviewees may be afraid to speak or to speak frankly when the interview is taking place in a location where others can overhear the conversation. From the interviewer's side, distractions can also be present. Further, confidentiality issues can be violated when conversations can be overheard. Now, reaching the right people during a crisis is challenging without being physically in the field. We know that sometimes first-hand observation is what is really needed, but that was not possible during the initial stages of COVID-19 when the whole world practically went on lockdown at around the same time. We have no directory of vulnerable populations in existence, so it wasn't a simple matter of us pulling a document and trying to see who these vulnerable groups are. Of course, we could get these statistics from government offices, but these offices were also closed during that period, and these statistics are not available on a government website because they are very sensitive statistics. So the mandatory closure and curfew restrictions would have initially affected us getting access to these populations. And even if it was not a health pandemic, for example, access could otherwise be restricted, because if we have a natural disaster, for example, landslides and road blockages, etc., can still prevent us getting to the most vulnerable populations. So we still need to ensure that the uncounted or our most vulnerable are reached, even though there are mobility constraints. But we would need to really think through how we can go about this when you have something like a mandatory curfew in place where you're not even supposed to be outside unless you're an essential worker. Now, data quality would have definitely been affected. We know that collecting data of good quality is a fundamental requirement that all evaluators and researchers should be concerned about. There are 5 characteristics that define quality data. Accuracy or precision is very important and may be considerably more important depending on the nature of the research that is being undertaken. If this characteristic is not maintained, example for healthcare data, the data could be very misleading and could be quite disastrous when we're using it. Reliability or consistency is important for obvious reasons. Policy making that is not based on reliable and valid data can be disastrous. During a pandemic such as COVID-19, many secondary data sources would have been reviewed since primary data collection was not possible. If sources that collect the same data were contradictory, this would create reliability problems and would impact the credibility and trustworthiness of the data. Validity is also of great importance and affects our data quality. Timeliness, we know that data that isn't used almost immediately loses value with the passage of time. In a crisis, for immediate crisis planning in particular, we need to gather data quickly since it can mean the difference between life and death. Data that is too late could misrepresent a situation. However, we know that data collection may not be as swift since many participants may only be available at night. Furthermore, since shocks are generally unanticipated, the nature of the shock may make swift data collection impossible. For example, if a natural disaster cuts off the road access and disrupts utility services. Curfews and internet connectivity issues can also impact the timeliness of data collection. Further, requests for remote data will likely not be as effective and as quick compared to face-to-face environment for a number of very obvious reasons. Finally, completeness or comprehensiveness is also important because data that is incomplete is also quite dangerous and leaves gaps in the overall picture. Conducting robust research digitally and in many instances with limited digital access can be very challenging. Data quality, credibility, and rigor are likely to be seriously affected. However, it may be argued that it is better to get some data than none at all. Therefore, we would need to document our limitations in the methodology. Note also that switching to a different mode of data collection at short notice can affect data quality because additional training may be required for interviewers, but there is no time. Internet connectivity issues can also affect data quality if one or the other party is not hearing properly. In the case of self-completed surveys, data quality can also be affected by the participants' understanding of the survey instructions, their education level, and so on. Now, the trustworthiness of data sources must be thoroughly verified since trustworthiness is premium during and after a crisis. People need to have confidence in data. Considerable care, however, needs to be exercised when using data from the web. Even from trusted websites, World Health Organization, government websites, we need to still be careful. It's sad to say, but we are also noticing some challenges with the data that are published on these websites. For example, the Davy et al. 2020 news report in The Guardian noted that the World Health Organization and several governments internationally initially used flawed data to create policies on COVID-19 and have since changed their policies on COVID-19. More recently, only last week to be exact, July 17th, the UK government has halted the publication of the daily number of COVID-19 deaths over concerns that statistical flaws might be rendering the data inaccurate. What happened last week was that an academic study revealed that deaths may be actually overestimated because of measurement problems. Because if persons were diagnosed initially as having COVID-19, and then later died from perhaps a heart attack or being hit by a bus or a train, their death was still recorded as a COVID-19 death. So they recognized that they needed to look back at how they were measuring the actual deaths and reporting COVID-19 deaths. We also need to be careful with social media and proceed with some degree of caution. During the lockdown, I got I'm not really a huge social media fan, but I am on WhatsApp, and I got many things that looked quite authentic coming into me and made sense when I read them. But I never forwarded them to any colleagues or friends or family because I wasn't sure where they were sourced from. And so being a responsible person, I did not want to disseminate information where I was not clear on where it originated from, even though to me as an educated individual, it made sense what the PDF or whatever document I got was saying. I still didn't disseminate it because I couldn't see the source of it. So we need to proceed with caution when we are using social media data as well. And there can even be contradictions between the data that is on government websites in terms of the death rate, etc. So we do need to have confidence in data, and that's very important. This slide here is really to just hammer home the point of both trustworthiness of data and the timeliness of data. When I was preparing, when I look back at this on Sunday, I got the first set of stats at the top is from Sunday, July 19th. And then today I updated the stats. And with just a 3-day difference, we see that the confirmed cases globally has increased by over 653,000, and deaths have increased by 14,000, approximately 14,000. So in just a 3-day difference, the statistics have considerably changed. And this is important because when we were thinking about, policies at the local level, etc., it was just to show that you needed to act quickly and perhaps use a trend analysis to see what was happening. But initially we didn't have any trend. We didn't know what was happening because we had never seen this before in our lives. So trying to do that at the initial start would have been difficult, but then later on we could have started to do some trend analysis. But what I'm trying to get the point across here is that we can't waste too much time when we're collecting data in a crisis, because the data changes so quickly and so swiftly that it could become obsolete if we take too long to collect it and then disseminate it to the relevant stakeholders that need it. Sampling methodology. We know that as evaluators and researchers, generalizability is often important in many types of research. However, the use of probability samples and even some types of non-probability samples may not be possible during a major crisis. At best, we will probably only be able to use a very basic convenience sampling methodology. And we must recognize, I often find this problem at the graduate level when I'm teaching, that students would often tell me they're using a convenience sample, but then in the way they write their reports, they would say they generalize from the sample. So in the event that some persons who are on this webinar are not clear on the sampling methodologies, just remember that if you're not using a probability sampling methodology, you cannot generalize. And that's okay, because it is acceptable under circumstances, but it's just to note that you cannot generalize from a non-probability sample. Response rates tend to be lower in a virtual environment. In a face-to-face environment, an interview that is scheduled generally takes place. In a remote environment, people are less likely to feel embarrassment for not filling out an online survey or appearing for an online interview. The same thing can be said with respect to data collection, where data is needed from a particular organization. An in-person visit is generally much more effective compared to an email request or phone call. Further, many organizations have answering machines and persons can simply say that they did not receive the message. This could be true in some cases, but may also be used as an excuse when persons are busy and don't want to be bothered with other activities. Empathy being lost. So this one really came home to me because of certain things that I saw on news, as well as when I really sat down and thought about it in some more detail. So we know that one of the most critical attributes of a good interviewer is the ability to put persons at ease. However, expressions of empathy and kindness will either be lost or will not be as effective when social distancing is being observed and when masks are being worn, and may actually convey detachment to participants who need strong emotional support. A few weeks ago, I saw on BBC that many persons expressed concern. Well, it was actually pastors that they were interviewing, and they were expressing concern with actually trying to comfort the dying or very sick while maintaining physical distancing and wearing masks, because people didn't really feel comforted, because you know that if you've been in a hospital and been very sick and a pastor comes in, they generally hold your hand, pray with you, etc. But these things were not possible and were restricted during the COVID-19 lockdown, etc. So even today, as things are a little better, but not very much so, they still cannot hold people's hands, etc., and pray with them in the same way. So the way that you can relate to somebody who you're trying to get a connection with can also be very challenging when you have to maintain this physical distancing and this wearing of the mask. Even if you were to observe body language on a virtual platform, it's difficult. For example, we have several participants on this webinar, but I'm not actually seeing any videos because we're not playing the videos because we're trying to keep the bandwidth a little better. So often, we are not actually seeing our participants, and we know that body language tells a very important story. It may even necessitate that the interviewer adjust interview protocol to be empathetic to the body language being observed, depending on the sensitivity of the interview. Furthermore, the use of masks in a face-to-face environment will also prevent the interviewer from observing facial expressions of the interviewee. Wearing a mask also distorts voice and may make a voice sound harsher than indicated, since a louder voice is needed. I really dislike wearing the mask, and I actually have breathing problems when I'm wearing the mask for any length of time. But one thing that I have observed is that my voice is relatively soft, and when I have a mask on, depending on the thickness of the mask, and I'm standing even close to, say, a cashier in a supermarket, they're not necessarily hearing what I'm saying unless I actually shout. And once I change my tone of voice, it may then come across as I'm being harsh, or I'm using a loud voice, etc. When we know that these things cannot be avoided, but for the person who needs the emotional support, it may just convey the wrong and incorrect message. Also, PPE equipment, as we all know, is quite uncomfortable to wear and may make both parties quite irritable. Primary versus secondary data sources. So primary data sources may not be an option during a crisis. In such cases, we can tap into many secondary data sources. For example, we can look at crime statistics to get an idea of domestic violence, official educational statistics to get school attendance, tax records, low income housing to get vulnerability statistics, etc. However, even getting access to these secondary data sources would have been challenging during the lockdown, because we were not supposed to be out on the streets unless we were frontline workers. So it would have been pretty challenging, because we couldn't go on to any government website and hope to get these types of statistics, because these are confidential records and they would not be in public domain. Notwithstanding, once we got access to the data, we still need to validate the integrity and credibility of secondary data sources, since these sources are gathered for another purpose and may not be entirely suited for the present data collection needs. Specifically, it is important to ascertain the standards used for data collection, to recognize that the data may be dated, can contain errors, can be inaccurate and may even be incomplete. Additionally, there may be extensive nuances even for data collected for the same purpose and inconsistencies between secondary data sources themselves. For example, a discrepancy between cluster-level data and household data may be due to geographical boundaries. Household data may be quite different depending on who completes this survey, maybe the male or female head of household. Certain populations may be underrepresented, and so on. Cross-validation of secondary data sources is thus critically important. If secondary data sources are being used, you must be aware of the advantages and limitations of each source. Note also that access to some types of secondary data may not even be possible during a crisis. For instance, data that was not publicly available on the organization's website would not have been accessible during the COVID-19 lockdown. Keep in mind also that your questions must drive the methods and data and not vice versa. Preservation of research ethics during a major crisis and in this new environment is also likely to be of increasing concern. For example, if there is a lockdown and institutional review board approval is necessary, how is approval obtained when data is urgently needed to identify the most vulnerable? Can confidentiality and anonymity be preserved when data is collected remotely with both the interviewer and interviewee in the home with multiple persons? Is harm being caused to participants who answer questions under such stressful conditions? How can the safety of both participants and data collection personnel be maintained? So these are still concerns that we need to be taken into account. The process for engaging a diverse array of stakeholders will also be challenging. Evaluators need to hear multiple voices, yet physical distancing, lack of access to technology, curfew restrictions, and other issues can prevent evaluators from engaging in sufficiently wide consultation and hearing the voices of the hard to reach. Moreover, decision makers and other stakeholder priorities have considerably changed. Most persons now have significant additional commitments to try to get their operations up and running and to recommence rebuilding of their companies and economies. This means that there's little or no time to engage with evaluators. Trying to source data from critical stakeholders will therefore be a challenging endeavor in the immediate future. Now, cost implications for data collection during COVID-19 and in our new normal is likely to be considerably more compared to before, because we have a number of new requirements for physical distancing and personal protection equipment, and also curfew restrictions during a crisis will also limit daily time in the field. Much more time will now be required to get the same work done. This means more days for per diem costs and personnel costs. It may even necessitate the provision of PPE equipment to all interviewees since they may not be able to afford this equipment. These issues all have cost implications as well as time implications. Additionally, there's the possibility that airfares may increase. This, coupled with quarantine restrictions in both the destination and home country, will definitely increase the overall cost of data collection as well as the timeline. I don't think any of us even want to travel, because just the thought of having to spend 2 weeks in quarantine in the country that we're going to, and then perhaps 2 weeks when we return to our home country, is going to take such a long time period out of our busy agendas that we probably will try to refuse and protest, in addition to the safety concerns, to even try to travel at this time. One option may be to determine the extent to which the evaluation can be scaled down without compromising the quality of the evaluation. So in conclusion, we have little choice really than to try to adapt to the nuances presented by COVID-19 or any other major crisis. This has clearly shown us that we really have to be quite flexible, which is not an easy thing in the immediate at the immediate time, but over a period of time, we can get it right. When something significant happens, proceeding as planned can carry a serious risk of harm to participants. It may even require shifting focus since problems may have changed. In the case of COVID-19, some fieldwork was delayed. However, since data was needed to get assistance to the most vulnerable, delaying data collection would not have been an option in all cases. Given the numerous challenges present, it may have been acceptable to reduce the scope of the evaluation. However, scope reduction, as we know, can seriously affect the quality of the final product. At the same time, it might be argued that some data is better than no data at all. Managing and mitigating risk is therefore important. To quote Michael Quinn Patton, we need to embrace change, don't resist it, expect change and facilitate it. Admittedly, this may require training to adapt and respond appropriately, which may not be possible in the immediate short term, but as I mentioned, we can get it right over a period of time. And now, well, that basically concludes my presentation. I'd now like to use the remaining time to invite participants who are on this webinar to share any experiences that they had with data collection so we can learn from each other. And yeah, we can, by learning from each other, we are able to better strategize about how we go about things in the future. So thank you very much. Valerie, are you still there?
I'm here, yes.
Oh.
So the floor is open. Yeah, there's a question here from Kenel Kadey, who found the presentation great, very insightful, and he was wondering about how the pandemic affected evaluation costs and, you know, adjusting to the situation. I think you've answered a part of that already. But
well, a remote data collection has less data connection cost if you have access to the technology and the people that you are trying to connect with have access to the technology. But if you then have to resort to switch into an interviewer mode to administer the survey, that would have increased the cost from that perspective. But it would really depend on if the people that you were trying to reach out to could understand the electronic surveys, etc., because those usually have much less cost compared to if you're doing something face-to-face. And we were not able to do anything face-to-face for the first 3 months during the lockdown.
mm-hmm.
Of course, as we start to reopen and we start to travel, if some of us are brave enough to venture out there, we will incur more costs because trying to get the same thing done within the field is going to take a lot longer because we have to be under so much more restrictions, the time limits. Certain countries may still be open, but may be saying that, you know, after 6 o'clock is the curfew, you need to get home by that time. So we can't be as late as we would on a normal basis in the field, etc. And when we're in the field, by virtue of the fact that we have to do the physical distancing and the mask and everything, people may not be hearing us clearly. They may not, you know, the connection may not be there. It will be more difficult, so more time is being lost. It may look like just a few minutes are rolling by, but every minute from an evaluator who you're paying an evaluator by the day is going to come up to more cost in the end.
Okay.
But I was curious to know, I mean, were people collecting data during the lockdown and what were their experiences with the remote data collection? Did they have internet connectivity problems? Did that frustrate the process? What are their thoughts on the whole issue with can you really, when you're doing sensitive interviews and you're wearing a mask and have this physical distancing, connect with your participants, etc.? What were your strategies that you used?
Yeah, Alan has a question about the ethics of the remote evaluation. Alan?
Thank you, and thank you, Dr. Persaud. That was a wonderful presentation, and thank you again for being part of our webinars. I was reading an article about a drug counselor who was operating in the Netherlands. And as part of our counseling work, she was using Zoom meetings. And rather than the people coming to her office for counseling, she would often have to Zoom into their homes. This gave her an insight into their living conditions that she didn't otherwise know. So she saw, for example, one person who was living in a squat, and just the sort of circumstances of his life there, or another woman who was lived in a car park. So whilst she was privy to that, and she found that helpful to understanding the cases that she was working with, the individuals that she was working with, it also brought to mind maybe situations where we as evaluators might actually be zooming, as it were, into somebody's home and seeing things that might cause concern, such as safeguarding or child protection issues, or just those general privacy concerns. And I just wondered whether we have to adapt our ethical considerations to take account of a much more potentially intrusive form of inquiry face-to-face.
That is a very interesting question, Alan. And to be quite honest, IRB boards will need to be the leaders in that, because we take, even though we don't actually go through IRB when we are doing an evaluation, unless we have government funding or something like that, and there's a special requirement for it, we still, at the back of our mind, because we have all been trained at either the master's or PhD level to know what IRB requirements are and how we should protect human subjects. So we keep that in mind as we are designing our evaluations. But that's a real concern. Even in terms of teaching, I had quite a blowout in one of my classrooms because, and you know, I thought students needed to conduct themselves more appropriately because they're on a virtual platform on the university site. And I just happened to mention that we would be using a software called Responders for their final exams, where they would be monitored with a camera, and their computers would be locked down and they would be monitored with a camera while they were doing their exams. And students got quite out of control and posted some really vulgar chat messages in the chat, which I wasn't paying attention to, because as you know, if you're trying to control a chat and deliver a lecture and do everything else and listen to what people are saying, it's quite demanding. So I wasn't paying attention to the chat, but it was brought to my attention later. So that exposed me to the fact that people are concerned, even when it wasn't in what you're referring to, the interview process, where sensitivity is more a concern there, that people didn't even want these cameras on them, even though they knew that it was an exam that they were doing and that they should have some kind of safety measure in place to see that somebody else wasn't physically writing the exam for them, etc. In the end, we didn't use the software, but it raised some serious concerns about, do we actually have the right to do that? And could we have implemented it so quickly? I mean, come December, they will be given an option that, you know, they have a choice. It's either they agree to use it. So we didn't use it in the end. But come December, if we have to teach online and they have to do their exams, they will be given a thing where they have to sign it on the screen to say they agree, they know they're being recorded, etc. And the video is on them and everything is being recorded, etc. But they will be given that option that they can either do it or choose not to do their exam and take it the next time it's available in a face-to-face environment. So I would really believe that IRB institutions will have to take the lead on that, because it's a very serious concern. I mean, imagine you're interviewing somebody and you're seeing into their home, and then their spouse, it's a domestic abuse situation, and they come and you might actually witness them getting literally manhandled by their spouse. And there are a whole lot of other things going on in the background. People might be cursing and fighting and all types of things. So I think what we would have to do if we are going to be using this in the future is that it would have to have something where they're signing, at least in principle, to say that yes, they acknowledge that they are being recorded and they are aware of it, and then we can proceed with the interview. But it's still challenging because we know that those things are quite sensitive, and I would really need, I wouldn't want to give the advice here. I would think that at best, all of that we can do right now is to have something on our survey or interview that they sign, literally tick it and submit it. So we have that somebody from the home actually sent that back to us. They were
Yes.
aware we were being recorded. But I would say that IRB has to be the leader in that to give us guidance.
I'd agree. I think it's a very sensitive question, but certainly I think as in any interview, to ensure that you have informed consent and ensure that people know that there might be, if they make disclosures, that you might be required to inform the authorities. But thank you for that, and I hope it's something that IRB boards will give the leadership on. So thank you.
Because you see, the other issue, Alan, is that we could, even by them signing that, we are kind of guaranteeing confidentiality and anonymity. But what happens if somebody hacks into the website and gets that data? How do we control it?
Yes.
Because
yes.
when we first started with the Zoom platform, and we were also using Blackboard Collaborate, but some of us switched to Zoom because we were already familiar with Zoom. I had large classes with 300 students, so the Zoom platform was much more powerful than the Blackboard Collaborate platform that the university has. But then we had all these issues with people. It didn't actually happen to me personally, but there were lots of news reports in the US and Europe that people were hacking into the Zoom classrooms and actually putting offensive pornography and sex acts and all kinds of things into the classroom as people were teaching. And we had people had no control over it because somebody actually took over their computer and then projected what they wanted into the Zoom classroom. So these are other concerns that, HIRB would really need to think about, because we can give that by them signing that or ticking it or whatever. But then what happens if somebody hacks in and it is such a confidential interview and, somebody makes that public? Those are things that we really need to think about. I don't know that we can have the answers because, as I said, all of us, although we don't generally get IRB approval for most evaluations, we do keep in the back of the mind, because of our training, that we need to protect human subjects. And so when we design our methodologies, we keep this at the forefront of our minds.
Indeed, yes, yes. Thank you very much. Thank you.
Valerie, we have very quiet participants online. Nobody had anything to share with any experiences.
Claudia Chambers was saying how that respondents even now are cautious about entertaining interviewers face-to-face to be part of interviews.
Because you know that even like when you think of the meetings that you have in your office environment and so forth, do you ever realize that people tend to be much more free in their speech when they're just talking and the minutes are just being recorded manually? From the time they know they're being recorded, they see a record in the room and they're told that they're recorded. Like every Zoom now, they're telling you they're recording you. People tend to clam up. They're not speaking as freely, etc. And that has real implications for the kind of quality and depth of data that we can get when we are doing qualitative interviews in particular. Because people will not be speaking as freely because they know they're being recorded.
Yeah, this is true. And another thing too that I'm finding is that commissioners of evaluation now, well, a lot of the work is being done remotely, and for some reason they have figured in their minds that it's going to take less time. And I don't know how that calculus works, because the truth is that, whereas you could spend maybe 2 hours easily chatting to somebody in an office, there's absolutely no way you can engage somebody for 2 hours online, And so in as much, the only time saving part I find of, monitoring or evaluation is that maybe you don't have to travel from place to place, say once you're in the country or so on. But you have to prepare even more. You have to focus much more, and it's extremely tiring.
Mhm.
So in terms of calculating what is the real cost and what is a fair fee for that, even though, you may, as I said, you may save time traveling from place to place, but to cut it by a third or a half, to say, okay, well, you're not traveling there, and it's going to take less time because you're not actually face to face. It's not true. The next thing is that you have to read a lot more. You have to, because a lot of the things you would pick up while you're maybe traveling with um, project implementing partners, or in the field with them, you're not picking up in a 1 hour or hour and a half session online. So you have to keep going back for additional information. You have to scour the documents a lot more. I think it's as tiring or even more so.
And the truth of the matter is, I mean, when we're doing something face to face, people feel that embarrassment and they're there. When you do the appointment or you go in to collect the data, etc. But they're not feeling that when you're making a remote request. Even though they know it's urgent, they're like, our life is so upside down now.
Exactly.
That we don't have time for that. And to us, that is trivial what you're trying to get, because we need to be thinking about how we're going to save jobs in our organization, etc. We don't have time for these trivial side things that you are trying to get data for. So it is pretty challenging. But Valerie, thank you. I have to leave now because I have another meeting now that I have to go to. But I will share the PowerPoint with you. I'll send it to you, so I'm not sure how you usually discuss.
And we have the recording. Oh, Lenny's had a question. I don't know if you have time to take one more short, but
I don't. But I could I could just snip it and then respond to her.
And then respond.
Right.
I'll send it to you.
Okay.
Okay. Well, thank you very much, Nadini. It was very interesting. A lot of we can relate. Most of us, I'm sure, can relate to a lot of what you've said. And let's keep the thinking going and the exchange going. So thank you, everybody, for joining us. And I think we have to continue this conversation because it evolves, and all of us are going to be gathering experiences. So it would be good to share.
Okay, well, thank you everyone for joining. It was really a pleasure to be able to present. I always tell Valerie, she's going to deny it, but I know I should be doing more for the CEI, and I don't do sufficient. But at least when I can come and do this every couple of months, I feel a little better that I'm not completely neglecting what I'm supposed to be doing. But that's all.
Absolutely quality, if not quantity, Nadini.
All right. So thank you, everyone. And I hope everyone stays safe. It's really challenging, even as we open airports, etc. And pretty scary because I live alone in Barbados. So, I haven't seen any family members for a while. So that's also, if I'm not keeping myself occupied, it's going to take a toll on me at some point. So keep myself fully occupied. So I hope everyone keeps safe, and send a question from Lenise and I'll try to respond to it.
Will do.
All
right. Thank you.
Bye.
Thank you all. And I will be sending out a short survey to everyone. So please look out for that and respond to it as quickly as you can. Thank you.